Hello, everyone, and welcome back to the channel. I'm Dr. Jennifer High, and today we're talking about something that affects almost every single person watching this video right now, whether you're 65, 75, or even 85 years old. We're talking about blood pressure, and more specifically, what is the right blood pressure number for you as you get older? Now, I want you to stick with me for the next few minutes, because what I'm about to share might completely change the way you think about that number your doctor writes down at every visit. Many seniors are walking around either over-medicated or undertreated simply because they were given a one-size-fits-all target that doesn't actually fit them. And by the end of this video, you'll know exactly what range is healthy for you, what symptoms mean your blood pressure is too low, and what silent signs mean it's creeping too high. So grab a cup of tea, settle in, and let's get started. Let me start with a story. I once had a patient, a lovely 78-year-old woman named Margaret, who came into my office looking exhausted. She told me she'd been feeling dizzy every time she stood up from her chair, and twice she'd nearly fainted in the kitchen. When I checked her chart, I saw her blood pressure medication had been increased at her last visit because her reading was 145/85, which her previous doctor considered too high. But here's the thing. For a woman her age with her health history, that number was actually perfectly fine. The medication increase had pushed her blood pressure too low, and that's what was causing her dizziness. Once we adjusted her dose, she felt like herself again within days. Margaret's story is incredibly common, and it's exactly why this topic matters so much. So let's break down the actual numbers. For decades, the gold standard target for blood pressure was 120/80. This number got drilled into everyone's heads through commercials, doctor's office posters, and even those automatic blood pressure machines at the pharmacy. But research over the last several years, including large studies looking specifically at older adults, has shown us that this target doesn't apply equally to everyone, especially not to people over the age of 65. For most healthy older adults, somewhere between 130 and 140 for the top number, called systolic pressure, and between 70 and 80 for the bottom number, called diastolic pressure, is generally considered a safe and reasonable target. This is sometimes called the sweet spot for seniors because it's low enough to protect your heart, brain, and kidneys from the damage that high blood pressure can cause over time, but high enough that your brain and other organs are still getting adequate blood flow. Now, why does this matter so much for older adults specifically? Think of your blood vessels like garden hoses. When you're young, those hoses are flexible and stretchy. As we age, they become stiffer, like an old rubber hose that's been left in the sun for years. When the hose is stiff, it takes more pressure to push blood through it effectively. If we force that pressure down too aggressively with medication, trying to hit that younger person's target of 120/80, we can actually starve the brain and other organs of the blood flow they need. This is exactly what happened with Margaret. Let's talk about what happens when blood pressure runs too high for too long, because this is the flip side of the coin, and it's just as important. Chronically high blood pressure, say consistently above 150 or 160 for the top number, puts tremendous strain on your blood vessels. Imagine a balloon that's constantly being overinflated. Eventually, weak spots can form, and those weak spots in your blood vessels in the brain are exactly what can lead to a stroke. In the heart, that same strain can lead to the heart muscle thickening and eventually weakening, a condition called heart failure. And in the kidneys, those tiny, delicate filtering units can get damaged over years of high pressure, eventually leading to kidney disease. On the other hand, let's talk about what happens when blood pressure drops too low, which is something that doesn't get talked about nearly enough. When blood pressure is too low, especially in older adults, the brain doesn't get enough blood flow, particularly when you stand up quickly. This is called orthostatic hypotension, and it's one of the leading causes of falls in seniors. And falls in older adults aren't just, oops, I fell down. A fall can lead to a hip fracture, which can lead to surgery, which can lead to a hospital stay, which can lead to a loss of independence. So when I see a senior patient with a blood pressure reading of 105/60, even though that number might look great on paper, I get concerned, not relieved. Here's a catchy way to remember this. I like to call it the Goldilocks zone of blood pressure. You don't want it too hot, meaning too high, and you don't want it too cold, meaning too low. You want it just right. and just right for most adults over 65 tends to be that 130 to 140 over 70 to 80 range I mentioned earlier. Now, I know some of you are thinking, Dr. Jennifer, my doctor told me my blood pressure needs to be under 130 no matter what. And for some people, that's actually appropriate. If you're a relatively healthy 70-year-old without a lot of other medical conditions, tighter control might genuinely benefit you by reducing your long-term risk of stroke and heart disease. But if you're 85 years old, living with diabetes, kidney disease, or a history of falls, that same tight target could do more harm than good. This is why blood pressure management for seniors absolutely cannot be a copy-paste approach. It has to be individualized based on your overall health, your other medical conditions, your risk of falling, and honestly, your own personal goals and quality of life. Let me give you another example that really illustrates this point. I had a patient named Robert, 82 years old, very active, still plays golf twice a week, no major health issues besides mild high blood pressure. For Robert, pushing his blood pressure down toward that 125 to 130 range made complete sense because he's strong, he's stable, and the long-term protective benefits for his heart and brain outweighed any small risk of dizziness. Compare that to another patient, Dorothy, 89 years old, frail, has had a couple of falls in the past year and lives alone. For Dorothy, my goal isn't to get her blood pressure as low as possible. My goal is to keep her steady, alert, and safe on her feet, even if that means her blood pressure runs a little higher than what a textbook might say is ideal. So how do you know what's right for you? Here are a few practical signs to watch for. If you're experiencing dizziness when you stand up, lightheadedness, blurry vision, unusual fatigue, or you've had a fall or near fall recently, these could all be signs that your blood pressure is running too low for your body, even if the number on the machine looks good. On the flip side, if you're having frequent headaches, especially in the morning, vision changes, shortness of breath, or swelling in your ankles and legs, these could be signs your blood pressure is running too high and isn't being adequately controlled. I also want to touch on something really important, which is how you actually measure your blood pressure at home, because this can make a huge difference in getting an accurate picture. Make sure you're sitting down, feet flat on the floor, back supported, and your arm resting at heart level on a table, not dangling at your side. Avoid caffeine, exercise, or smoking for at least 30 minutes before you measure. And here's a tip many people don't know. Take 2 or 3 readings about 1 minute apart and use the average. Your first reading is often higher than your true baseline simply because of the anxiety of taking it, sometimes jokingly called white coat syndrome, even at home. Another thing I always recommend to my senior patients is to check their blood pressure, both sitting and then standing up after 1 to 2 minutes. If your systolic number, that top number, drops by 20 points or more when you stand up, or your diastolic drops by 10 points or more, and especially if you feel dizzy when this happens, that's something you absolutely need to discuss with your doctor. This single check can help catch orthostatic hypotension early before it leads to a fall. I want to leave you with one more thought before we wrap up. Blood pressure management in older adults isn't just about chasing a number. It's about balancing the long-term protection of your heart, brain, and kidneys with your day-to-day quality of life, your independence, and your safety. The goal isn't simply to live longer, it's to live well, with energy, with stability, and without the fear of falling or feeling foggy and exhausted all the time. So here's what I want you to do after watching this video. Look back at your last few blood pressure readings, whether from your doctor's office or your home monitor. If your numbers are consistently running below 120 over 70 and you're experiencing any dizziness or fatigue, bring that up with your doctor. Don't just accept a lower is always better mindset without a conversation. Similarly, if your numbers are consistently above 145 or 150, that's also worth discussing because that range, sustained over years, can quietly increase your risk of stroke and heart problems. I always tell my patients, you are not just a number on a chart. Your blood pressure target should be as unique as you are, shaped by your age, your other health conditions, your activity level, and your personal goals for this stage of your life. The best blood pressure for older adults isn't a single magic number that applies to everyone. It's a personalized range found through conversation with your healthcare provider, careful monitoring, and most importantly, listening to how your own body feels. If you found this video helpful, please give it a thumbs up. That simple action genuinely helps this information reach more seniors and families who need it. And if you haven't already, hit that subscribe button and tap the notification bell because every week I break down topics just like this one, the real, practical, no-nonsense health information that affects you and your loved ones every single day. Drop a comment below and let me know, what's your current blood pressure target, and has your doctor ever explained why that specific number was chosen for you? I read every single comment, and sometimes the best topics for future videos come directly from your questions. Until next time, take care of yourselves, stay steady on your feet, and I'll see you in the next one. This is Dr. Jennifer High, and remember, your health is your wealth.